Hey guys, welcome back to the Altmed podcast. Andrew Dowling here. Mitchell Kurtz, my co-host, is in the house.
Hello.
Hey Mitch. We've got this episode. We've been looking forward to this one for a little bit of time now. We've got a vet on the show. We have Dr. Christopher Lee from Pet Universe in Adelaide. He also runs the Canine Rehab Centre. Welcome, Dr. Chris.
Hi, thank you very much, Andrew and Mitchell. Glad to be here.
Glad to have you.
Yeah, we were sort of looking to try to have somebody on who has some experience, working with animals and cannabis. And we thought, who do we know that likes to get dogs and cats high? And your name came up, as did others. But can you tell us how you got into getting dogs and cats high? How did you get into space?
Well, I guess I've been a vet for over 30 years now, so that's quite a long time. And as vets, we always seek to improve our skills and always seek to improve our outcomes for our patients, So over the years, I've developed a very strong interest in surgery. So we do a lot of advanced surgery, all the cruciate repairs and fracture repairs and, quite a few difficult surgeries that cause a lot of pain, essentially. So then it was natural for me to look into pain relief and how to achieve that. And I started off with acupuncture many, many years ago after I graduated. And over time, it occurred to me that we weren't really getting the best of everything we can do. So I looked into rehab and decided to go to America and do the rehab course in Tennessee, which is the only race accredited course for rehab. So it's the only university recognized course. So I've completed that about 3 or 4 years ago. And then the natural thing, of course, is natural curiosity. When CBD became legalized or more available, I contacted CBD Vets Australia, and we started collaborating to use CBD in animals. So that's, I guess, how it sort of progressed. And with rehab, we've started looking at alternative ways of pain relief, including laser therapy, electrical stimulation, exercises, and looking at the long-term function of a patient, not just, oh yeah, you've got a broken leg, let's just fix that and see you later. And they could take a year or two to recover from that. But with the aid of rehab, we get them walking and back to normality within 3 to 6 months. So the improvement in quality of life and reduction in pain is huge. And then, of course, we get to CBD. And CBD can also help. And I've certainly found that the more I use it, the more I use it in more cases because of the effects I'm getting out of it.
Amazing. And so when you're talking about using it for animals, what types of animals are the traditional ones you would see through your clinic?
So we are a small animal practice. So we do dogs and cats predominantly, occasional rabbits, and the rat too, some birds. But
I love your job, Chris. I went to work today and I gave this rabbit some CBD.
And it was happily happy. But look, the CBD is an interesting thing because we've only really looked at the whole pathophysiology of endocannabinoids and the system that's involved in it over the last 20 years or so. The research has been going before, but it really hasn't taken off. So the more I read into it, the more it seems that it's integrated into everything. It's quite an ancient system. So it affects your behavior, your mood, and of course that's where its reputation comes from as a high for people smoking cannabis. But it's an anti-inflammatory. It's a anti-cancer drug. It's been proven to reduce the rate of cancer growth. They've started researching it as a novel antibiotic as well. So, we've got all these extra benefits that we weren't really expecting. And we do also know that now there's a lot of articles out there now showing that it's neuroprotective. In other words, it helps in nerve issues as well. So, the original use of it, of course, is for pain relief, anxiety, epilepsy, maybe. But now there's a lot more potential for its use in other areas as well that we're just starting to look into.
I do. It would be remiss of me not to ask. What's the most sort of exotic animal that you've worked with? CBD? Any gorillas, or do you maybe actually native Australian, like koalas, kangaroos, platypi?
Possums, yep. That's a dodgy one. Some people love them, and a lot of people hate them.
That's how they got their ring tail.
Yeah, well, look, we see a lot of exotics as rescues, and they're not really with us for very long. They go to rescue centres as soon as we do the first aid care on them. So I haven't actually admittedly used CBD on any of those, but honestly, it would definitely work. It works very similarly across all species, I think. And I guess the interesting thing about it is that some research done on dogs show that they have the most CBD receptors in your body compared to people. Wow. So it actually works. Dogs are fantastic candidates for CBD therapy.
Is that Sorry.
No, I was going to say that actually brings me straight into the next question I had, which is, what is the difference between a dog taking CBD and a human? Like, how does the interaction change, if at all, between those two?
I think it's fairly similar. The side effects are the same. I mean, there are I guess, subtle differences as how it's metabolized, and it might affect different organ systems. For example, in a dog, it would affect the liver in a certain way, and in cats a different way. So we get different markers in our blood tests. But essentially, the broad stroke of what it does is very similar. So, and I guess the differences we look at is how it works in the different species. For example, dogs respond very well to it, but cats absorb it at a much slower rate. So, and it also seemed to take longer to metabolize it. So it's sort of a little bit different as to your frequency and doses in different species, but the effects are pretty much the same. And I think the toxicities are pretty much the same. And I think it probably comes from the fact that it's a very ancient system. We've all, even invertebrates, not just vertebrates, have CBD, and I guess obviously plants producing phytocannabinoids, which is cannabis plants, must be using those hormones as well. So being an ancient system is probably ingrained into a lot of our processes, and therefore, as we evolve, those basic processes stay the same as we evolve, if you know what I mean. They're not recent addition to our physiology. So that's why I think it acts very similar in most species.
So what about, you talked about your work in canine rehab and all of this. So I know you seem to have experience with helping out dogs through that process. But what about, we hear about conditions like just anxiety that some pets might experience. Do you have any experience working with CBD or cannabis for managing anxiety?
Oh, that's a great question, Andrew. That's a good one, because look, so many pets suffer from anxiety, barking and, aggression, because unfortunately, if you're scared, you generally have a couple of options, flight and fight response. Yeah. So you either freeze and don't do anything, or you fight and attack, or you run away. And if you have a bigger dog that's genetically made as a guard dog, then their default reaction, of course, is to fight and bite and attack. And it is a serious problem. It's one of the greatest risks of or causes of mortality to younger dogs is due to behavioral problems, because we euthanize them, unfortunately. There's a lot of help available for it, and certainly I think CBD plays a role in treatment. I tend to generally use the medications for anxiety more in the older patients that are starting to have senility changes, more so than I do for aggression and behavioral issues, although I'm sure it'll be very helpful. Just as I guess, it's probably no surprise to yourselves and people are familiar with CBD, it's not actually a cheap drug. And there are cheaper alternatives for behavioral issues that are very, very effective. So we tend to lean onto those with those cases for anxiety.
Sorry to interrupt, Chris. I was just thinking, in terms of the crossover with therapeutics or medicines for humans, is it similar with veterinary medicine where your predominant anxiety and would be say an SSRI, but for dogs? Is that when you refer to the cheaper?
We use the same drugs. Yep.
Same drugs.
Prozac, Seroxat, all the same. I'm trying to remember the human names from, but all the same drugs that we use in humans are used in dogs. They're just not licensed. That's all.
Yeah.
So
Pooch Valium.
Pooch
Prozac. Yeah, well, Valium. Yeah, we use Valium a lot too. Alprazolam, Xanax. Heaps of that stuff is being used all the time. So the issue, really going back to the original question, is I do find that we've had some really good results with cognitive dysfunction syndrome in old dogs. I mean, these are dogs that are starting to circle, they're starting to stare into space, they're starting to be stiff and painful. And if you think about it, it's good for both pain, it's an anxiolytic, it's an antidepressant. And I guess about 9 out of 10 dogs that we start CBD on that's for these indications, we get ridiculously good results when people are coming back saying, my dog's is a new dog, can't believe it, it's time to play again. It's certainly sleeping at night. When you're awake all night with the dog pacing, and you're feeling really stressed about how it's coping, having just that relief of giving the dog some medication that is relatively low in toxicity and does settle them down, it's a godsend, really.
Yeah, absolutely. It might help your starfish that's got a benzo addiction, Andrew. I think one of the things people ask, there's really 2 major concerns I think people at least write in and talk to us about. Will my dog get high? One, and is it going to die? Am I going to OD?
And depending on who's asking that first question, you sort of trying to work out, do they want to get their dog high?
Or where's the drug going to? So look, that's a great question. And I think the first thing to remember, of course, is that we mainly deal with CBD or Cannabis Oil. And that's not psychogenic. It doesn't have those effects. THC, of course, is the component that gives us the high. And for the most part, we use products, if we use full spectrum products, we use hemp full spectrum. So it's usually less than 2-3% of THC. And because of that, no, animals generally do not get high from it. They do get sedated because, if you use a high dose of cannabidiol or anything like that, then you can get sedation with it. And that's common with a lot of painkillers as well.
And what about in terms of the method? I assume you don't get dogs to vape, but how do we administer cannabis as a medicine? Yeah, well,
certainly vaping is a possibility, of course, but nebulizing. And of course, as we all know, cannabis needs to be heated up for it to have an effect. But we tend to use a liquid version, and I think it's mainly suspended in MCT oil. And of course, MCT is a great oil. Generally, with palatability, I've only had a couple of dogs that do not like full spectrum. Very little have knocked back CBD itself. But the full spectrum with the terpenes and the flavonoids and the odor in it, some dogs just won't take that at all. So that's quite interesting. But CBD itself, suspended in MCT's doesn't have an odor, pretty much tasteless. And I don't think dogs actually mind having it. So, nor cats. I haven't had too much issues with palatability. Occasional, but then of course you can use chicken flavoring and beef flavoring, which CBD Vets provide, which is great. And it can help get past some of those.
And do you go, I just curious, on the tongue, under the tongue, how would you?
Look, just give it to them and they can swallow it. We just can't, try even giving medications hard enough. I believe in keeping things simple because, if it's hard, people just don't do it.
Yeah, so it drops on like a schmacko or something like that.
Correct. Yeah. Straight onto food, straight in the mouth. however they can get it in, and it works really well.
Nice.
I've heard of the oil being almost like compounded into like pig's ears and things like this. Is that something that happens as well?
Yeah, and cookies and all sorts of things. I haven't had any exposure to using those because honestly, I don't see the need to. The format I'm with MCT oil and flavorants as needed has been absolutely, fabulous and totally effective for me. So I haven't had a need to do anything else. And putting it straight into food or straight into the mouth has been no problems.
And in terms of the dosing, I assume, given the size differential between humans and pets, they will take I'm guessing.
Depends what dog, right?
I guess it depends on the dog, but even, the biggest dogs, I can't imagine they would be having close to a human dosing of CBD. Is that?
Well, what's a human dose? That's what I haven't figured out yet. I haven't actually. Obviously, I'm a vet, so I've only focused on what I need to give animals. But what is the standard dose that humans would get?
Well, the TGA's guidance, at least around what they're going to permit for Schedule 3, is a maximum of 150 milligrams of CBD a day.
Mm-hmm.
Would that be? You wouldn't be giving a chihuahua that, would you?
Well, no, definitely not. So, also, don't forget, dogs have one of the highest cannabinoid receptors, CB receptors in the body.
Yeah.
So we don't need as much of it, really.
Yeah.
And I start my dose rates probably at 1/4 milligram per kilogram. And I titrate it up because really at the end of the day, we're still dealing with a non-registered drug. So there are limitations in how we need to use it, and we need to use it in a safe and responsible manner. So as far as I'm concerned, also it's not a cheap drug either, in all honesty. So the less we use to get an effect, the better. So we tend to titrate it up and go, start at 1/4 milligram or so, 0.5 milligram per kilogram dose at night. See how they go for a couple of days, and usually nothing. They don't seem to have a side effect, any issues. Then I would do a morning and evening dose of the same level, and then every couple of days or so, I would increase the dose by whatever I started off with, 0.5 mg per kg or 1/4 mg per kg, until I get an effect.
Yeah.
And once I get that effect that I'm happy with, and the owners are seeing a positive reaction, or if they see sedation, then I tell them to take it back one step. So by titrating it up, we make sure that we don't get any side effects. And then, of course, after a week or so of staying on a stable dose, we often run a blood test just to make sure that there's no liver disease or any deterioration in body functions. And to date, I have yet to see one, which is great, because we have done a lot. And most of these just stay on that dose rate and get reviewed every 6 months. So it's the standard doses we work up to probably maybe 0.5 to 2 mg per kg per, once to twice a day for dogs, and cats. But I do get more side effects showing up in cats when I hit the 2 mg per kg dose rate versus the 0.5 or 1 mg per kg in cats.
And for if you notice that your cavoodle's got cotton mouth and trying to eat everything in the house, maybe dial back the THC a little bit.
Yeah, exactly. But exactly. But look, I actually use 90% of what I use is actually CBD itself, because they're more accepted and palatable. And we do have the THC full spectrum. And I tend to use those for refractory cases, or really painful cases. So things like cancer pain and things that I've tried CBD that's been working, but not working as well anymore. Then I might say, look, let's try some full spectrum on those cases. And in most cases, you get more of a psychogenic effect. They get a little bit more sedated quicker, but they do also seem to respond to it as well, which is good. So it's not as if CBD doesn't work, I go, right, that's it, you can't do any more. And I've titrated doses up to, when you were talking about toxicity, I've titrated doses up to about 10 mg per kg which is a huge dose
Wow.
for dogs, and sedation was primarily the side effect I've got, and even the blood test came back clean. So I was very happy to use the medications. And don't forget, a lot of our pain medications, they tend to have a lot of side effects. Almost anti-inflammatories would affect kidney function and can worsen kidney disease. So being able to use a painkiller that doesn't affect the kidneys is a godsend as well in many cases.
Yeah.
Now, I've seen as much as, is it 1,000 mgs per kilogram being non-toxic in humans as well. So it's for CBD.
Yeah, I think somewhere along the lines they gave.
I'm not testing it out, but
no, but they gave 3,000 milligrams to a dog, which is ridiculous. And they found that in toxicity trials when they were doing that, there was some liver abnormalities, but nothing deemed to be toxic or lethal.
Right.
But certainly the animals tended to die of aspiration pneumonia, not from direct toxicity of the drug.
Right.
So the safety margin is actually quite good. I mean, if you think about it, I think with human beings, if we have pure oxygen for over 24 hours, it's toxic to our system. So, we think about things that are toxic. Well, 24 hours of pure oxygen will kill us. Well, hang on a sec, 3,000 milligrams is a long way away.
Yeah,
they can't do that for most of our pharmaceuticals.
You can actually die of water poisoning as well.
Exactly. Right. You can indeed.
3,000 mgs. I'm just seeing that's like getting a little 10%, 30 ml bottle, just throwing it back like a shot.
I'd feel sick from the MCT oil before the CBD, I think. But I wonder, now I'm not sure how this works with pets, but do you have any anecdotal kind of stories that you can, I guess it has to be anonymized, but I'm not sure how the privacy stuff works.
Yeah, so I had this elephant that I was treating and gave 20,000 megs. No.
Oh yeah, and it was snorting up bamboo shoots. No, okay. Yeah, look, I guess just I've got really good cases that have responded super well, and I guess coming back to it, understanding that in some of these large animals, it can actually be quite costly to keep them on it, and I've got quite a few large dogs that people are spending the money on CBD oil for them. And that just goes to show the results they're seeing out of it. For, one of the classic things I was telling you about was for anxiety and for cognitive dysfunction. It does seem to help them concentrate better. It does seem to help them eat better, sleep better, reduce their pacing. So these animals that are, people are thinking, it's time to call it quits, but we just don't really want to. We're not ready yet. Using it for those cases, and they've responded really well in many of them. Some of them don't because they're just so advanced. We've got cases whereby dogs are in chronic pain, arthritic pain, and they've got kidney disease. And they come to us and go, what else can we do? And obviously they go into our rehab program. It's very multimodal in how we treat animals. There's no one thing fixes everything. We use everything in our arsenal: prescription drugs, non-prescription drugs, laser therapy. We just go all out. And when we do that, all these animals, they seem happier, more comfortable. And the benefit of CBD oil is because of that mood modifying effect. They just seem to be more content. And I think that's just gold. When you have an animal that is in chronic pain and suddenly they start wanting to play with a ball again, you go, what the hell? Isn't that amazing? Played with a ball for like 3 years. Yeah. And we see that quite a lot. I've got a couple of cases that literally has cancer. And we're going, end of last year, we started them on CBD oil, and we're going, look, if we get to Christmas, we'll be super happy. Past Christmas, they're still going strong. So it is now, whether that's the problem, of course, with a lot of these anecdotal cases is that it could just be luck. It doesn't have to be that it's CBD that's caused it, because there's no control to these guys. But certainly a lot of animals are living longer and having better quality of lives because of it. And I think it's a very valuable modality that also is relatively low toxicity. It just has to be used correctly.
Yeah. And I guess to that end, you touched on it before, just how, as dogs approach, the latter years, and that it maybe plays more of a role in treatment then. Is that sort of, in your clinical experience, are you more likely to have CBD prescribed when the dog's in pain, or just later in its life than say when a dog's in the first few years?
Yes and no. I guess it's an indication for what is best value for the client as well. I know we want to do the best for people, and it's also what people can afford. And certainly, if a dog is suffering from anxiety, and it's a 2-year-old dog, 1-year-old dog, because usually behavioral issues start between up to about 3 years of age, 1 to 3 years of age, when dogs hit social maturity. That's when they start having to make decisions and get anxious about the decisions they make.
Yeah.
So I certainly used it for those dogs as well, especially if people are seeking a more naturopathic remedy. And those have also responded very well. It's even easier to use on young dogs because there's less worry about toxicities and reactions as well, because they're so much more physiologically stronger. I've used it in cats for inflammatory conditions, and one of the biggest bugbears vets get is these cats that keep getting chronic urinary stress pain, cystitis issues that can be quite refractory to treatments. So once we've gone through our typical routine therapies, I'll reach for CBD and add it on top. And I find that a lot of those cats have responded extremely well and have been able to control it when our normal medications haven't been good enough.
Yeah. I think this is just a working hypothesis. Are all cats anxious? Because you never see a cat and go, oh, that cat's chill. You know what I mean? It's always, cats just seem to be perfect candidates for some CBD. Is that a fair statement?
I don't think so. I think
I would have said the opposite.
And I do, full disclosure, I do love dogs. I'm a little bit about cats.
Don't give our viewers a reason to dislike you, Andy.
There's a lot of cats are extremely chilled, and they're lovely. I mean, they're great patients as well. We respect cats because they're small, but they pack a punch above their weight. They don't just have mouths to bite you with. They've got like 4 little feet with 4 little claws in there that can cause certainly very serious damage. So, generally, I think cats have a different social system to humans and dogs. Dogs' social structure and humans are fairly similar in the way they look.
Yeah.
Cats tend to hide a lot more, and their social systems are much more subtle. So we don't recognize their social stress. So that's a good point. They could be more stressed than we think they are. But certainly cats in their natural environment and our home environment are really relaxed. They can be absolutely gorgeous.
Yeah.
Just coming back on track and off Andrew's pet preferences, what are your thoughts on black market cannabis versus legal for animals at the moment? Because I know that's something that comes up a lot.
Yeah, I'll stay clear away from anything that's not prescription-based, pharmaceutical delivered. And even then, I mean, it's such a challenge to get good drugs. About 4 or 5 years ago, there was a study done in America on human nutraceuticals that found that I think they trialed something like 200 or something like that. And don't quote me on the exact figures, but most of them did not have what the label said on them. And that was independent of price and brand. So these are human nutraceuticals you buy on the supermarket shelves. And they didn't have what they claimed on the label. So that was quite alarming, really. And I personally, I'm a cynic in by nature, but I honestly do not think that these companies out there to, rip people off or be deceiving. I think that because the nutraceuticals did not bound to the same regulatory pressures and quality control as pharmaceutical drugs, So they may have, said, oh, wow, we really would like to help people with arthritis. Let's go, get a, chondroitin, glucosamine, omega-3, whatever supplement, rosehip, whatever. And we'll formulate that, and then we'll send it out to the market and see, wow, we're getting such good results and people are benefiting from it. Well, the demand's gone up. Let's get some more of the stuff. And then they're getting more and more of this product in, and they're making it and sending it out, but the formula stays the same. And of course, you can't tell me natural products are the same year round, irrespective of the age of the product you're getting it from. You can't tell me a green lip mussel that's 1 year old has the same omega-3 as a green lip mussel that's 10 years old, for example, or a leaf has the same ingredients in it in spring as it does in winter or autumn, or the age of the plant doesn't matter, or maybe the ingredients of it with flowers or seeds in it may vary depending on the batches you're getting. So they're still making it with the same formula and sending it out. And of course, over time things drift. And unless it checks for quality and accuracy, it just drifts out of out of what it claims to be. So I think that's the same sort of issues with cannabis and any of these relative over-the-counter product, like legal product, black market products. The other thing about cannabis, from my understanding, is that there are three major ways of producing it: the solvent method, the olive oil method, and some carbon dioxide method, I think, just out of rough memory. And of course, the carbon dioxide method is the cleanest method. It brings out the cannabinoids, and it's pure, and there's no contaminants. It's a closed system. Whereas if you're using solvents to extract your cannabinoids, then they found toxic substances like benzene and petroleum products in those substrate, those products. And if you're using olive oil, you only extract a very small amount, so it's very weak.
Yeah, Mitch has got some thoughts about CO2 extraction. I can see a can of worms.
Not going to get into this conversation. There's a lot of different points on this discussion. But
I'm not going to go into this, but I just want to say 10 minutes about it.
No, Dr.
So, I'm sorry if I step on somebody's toes, but look, at the end of the day, as a veterinarian, I'm getting CBD Vets Australia sending me, an analysis of the oils that I'm getting, and it's 99.8% pure, and it matches the batch number.
Yeah, so that's what you want. That's what you want. 100%.
I know I have therapeutic doses. I know exactly how many milligrams I'm giving. I know the repeatability of it. I know that if my dog 2 years ago was on this product, I give it exactly the same dose. I know I'm going to expect exactly the same results.
100%.
And that's the thing that's really important to me, is that we're actually being able to measure accurately and stay away from toxic and side effect products and so forth.
Yeah, no, absolutely. That's 100% correct. And so say I'm a dog owner and my dog started showing signs of nervousness or something like that. What do I do? How do I get it? How do I get, what's this process because I know it's a little bit different. It's not entirely different, but it's slightly different to the human method. I know there's no finished dose goods, for example, in the pet world. So I'd love to just
give your dog to a new owner. I think that would.
I think a first good spot really would be to contact CBD Vets Australia. They deal exclusively in the for me anyway. They deal a lot in the animal field. They know all the vets that are prescribing it, like myself. And then they will give you the information and knowledge. They'll refer you to perhaps one of us that deal with it on a daily basis. We'll discuss the pros and cons. Obviously, the thing about medicine is really through education. People know what they're dealing with. They know the options of different therapeutics and what it can do. Then they choose what they want to use and then go from there. So it's all based on informed consent, because unfortunately it's not also a registered drug per se for dogs and cats. So it's used off-label, and it's something that they need to be aware of, what to watch out for if things go wrong, and why we're so cautious with it, with ongoing blood tests and so forth. And then once they've got that informed consent, go ahead. So best spot, CBD Vets Australia, go to the website, contact them, find a vet nearby to where they are, that deals with CBD, because not all vets deal with CBD. There's as many detractors as there are, protractors, I guess, for these products.
Yeah.
So what about? And I just want to ask about the medicine. With
no
the with the off-label, do you ever work with compounded medicines, or is that
all the time? That's where the CBD products come from, the compounded medicines, and that's how we get the volumes required to accurately administer the doses that we need.
Yeah, beautiful. And in terms of, do you know the rough costs if I'm looking to go through this exercise, take my dog to the vet? What is the average? Say I've got a racehorse that I want to get an advantage in the Melbourne Cup. Like, what cost would I be looking at?
Well, racehorses are a bit out of my scope. I don't deal with large animals. It depends on the size of the dog. It also depends on the dose you require, and a lot of that is titrated to effect. So it could be $50 in a cat, and it lasts for 3 months. It could be $500 for 2 weeks in a really large dog that's really sick, and we need to use lots. So there is a big variability. It depends on the dose rate and the condition and what's going on.
Okay. Interesting. Yeah, I think that's a really comprehensive, look, especially for somebody that's considering bringing their dog or cat or goldfish into for treatment.
That's a good one, goldfish. Unfortunately, it's oils, but I'm sure we can suspend CBD in aqueous water or similar. That'll be interesting.
Bad news.
Sure. Good research project.
Bad luck for anyone who's got a blue whale as a pet. It's going to be too expensive to treat. Anyway, all right.
Andrew, any other question? I think we've covered some great ground.
We did. That was a good. Thank you so much, Chris, for just fielding all our questions. A few of them left field, but
that blue whale, that takes some, that's maths that I think is beyond my brains to calculate. Actually,
we've covered blue whales, gorillas, seahorses,
elephants. Don't forget elephants.
Exactly.
Look, it's my pleasure, and at the end of the day, we all love animals. That's what we're here for, and it's been tough over COVID, and we all understand that. Vets have been under as much pressure as any other health professionals because of the increase of pet ownership, and it's a tough profession to be in the first place because we see so many sick animals, and we have to deal with the emotional impacts with the owners as well. So it's tough, and to have a product that can actually make animals more centered. And I'm not talking about high. I'm just talking about content. That has relatively low side effects. Great as a painkiller. Great as an anti-inflammatory. Has all these other bonus things like it could be anti-cancer and nerve protection. Anti-epileptic. So there are so many benefits of it. It's good to get it out there. It's good to get it out for people to know that it's available, and for them to consider it as part of their modalities to look after their pet. Yeah. And hopefully that brings a lot of happiness to people in the world and helps us all get through this COVID period.
Exactly. And, speaking as, as a Victorian that went through quite a few lockdowns, a lot of people just loved having their pets around, really, whilst they're working from home, just part of, their well-being was that connection to their dog or cat. But yeah, it's amazing the role that CBD can play in if your pet's happy or content, then that's obviously going to be good for the owner as well.
That's right. And look, if you need help being a vet that's interested in learning more about it, or being somebody that's interested in getting more information about it, CBD Vets, they're very easy to deal with. Look up their website. get the contact details, send them an email or whatever, and they'll get back to you with somebody that's close to you. If you're in Adelaide, South Australia, you're welcome to drop me a line or give us a call, and we'll be happy to help you at Pet Universe.
That's awesome.
No, we greatly appreciate it, because on behalf of a lot of people that are curious about this area, we all know how difficult it can be, especially with people, but especially with animals, to find somebody or a vet who's open to this line of alternative therapy. So yeah, we greatly appreciate the work you're doing.
I reckon we're going to get a few listens, a few views on this episode. A lot of people have been asking about this topic. So no, thanks so much, Chris. You've been such a good beacon of knowledge and experience to share with us. So thank you.
You're very welcome, guys. Have a good day.
Yeah, you
Cheers.
too.
You too.
Cheers.
Okay. Thanks for having me on. Cheers.